Opioid analgesics or narcotic analgesics. The mechanism of action of opioid analgesic is by binding to opioid pain receptors in the brain, then causing an analgesic response or pain relief. And the agents are receptor specific depending on which agent we're talking about. Therapeutic effect would include decrease in pain, and depending on which agent we are talking about, it can also decrease cough. It has an antitussive effect. Indications are moderate to severe pain, cough suppression, and adjunct to anesthesia. When we say adjunct to anesthesia, it's basically saying that this medication is added to another medication for anesthesia purposes. Some precaution include sedation, hypotension, this can decrease the blood pressure, respiratory insufficiency due to respiratory depression, slowed GI motility. Some side effects include, again, sedation and hypotension, respiratory depression, right? Patient not being able to breathe, nausea, vomiting, constipation, right? Because of the slowed GI motility. So this is going to be one of the most common complaints after, especially after administering opioids or being on opioids for long term. So nursing actions, we have to assess for therapeutic effect or therapeutic response as well as side effects. Assess for risk for injury, right? Because this can make them drowsy, it can alter their mentation, therefore it can put somebody at more risk of falling or injuring themselves. Also, it is important to assess the drug amounts and side effects with the use of combination drugs, because certain drugs taken in combination can potentiate their side effects and cause some adverse effects. And sometimes we may need to treat some side effects, especially in cases of overdose or severe reactions. So what we do for that is we give them antidotes. So for that, we use opioid antagonists. The one that you have to remember is Narcan or naloxone. This is a reversal agent. We have to make sure also that we assess the patient respiratory rate. These are some examples of drugs in this class. So we have codeine, we have Demerol or meperidine. This medication actually, we're trying to avoid that because of its severe adverse reactions. We also have Dilaudid or hydromorphone, fentanyl, which is the generic name, and it comes in variety of routes. It can be given as topical, transmucosal. It can also be IV. The trade name for the transmucosal one is Actic. Duragesic is a trade name for the topical patch, and the Sublimase is a trade name for the IV. But basically, the generic would be fentanyl. So the trade name is very specific to the route. Another medication in this class is Ultram or Tramadol. This is listed as a non-opioid in our text because it's not really as potent as the other opioid medications, but this is still an opioid medication. It is synthetic, it is centrally acting analgesic, and as of 2017, this has been classified as an opioid medication. Again, it's not as potent as the other ones, but because it has the ability to change patients' behavior and it can affect their mentation, this is considered a narcotic or opioid medication. In addition, one of the more known medication in this class is morphine. So there's different forms of morphine. We can give it via parenteral, right? So it can be given IV, IM, and sub-Q. We have MS Contin or morphine sulfate contin, which is a time-release tablet. There's also Duramorph or Astramorph, which is an epidural or intrathecal injection. There's MSIR or immediate release tablets. There are RMS or suppository, and there's also oral solutions. In addition, we also have Norco, which is hydrocodone and acetaminophen, as well as Vicodin and hydrocodone with acetaminophen. They're basically very similar. The only difference is that in Norco, the acetaminophen content is less. It's only about 325 milligrams. And in Vicodin, acetaminophen content is actually higher and often comes in 500 milligrams. That being said, Vicodin is no longer used. I believe it's already off the market. I will verify that, but we haven't been prescribing it that much because of the potential of overdose of acetaminophen. Next, we have oxycodone, which is basically OxyContin, and that's the extended release of oxycodone. We have Percocet, which is oxycodone with acetaminophen, and Percodan, which is oxycodone with aspirin. And again, just remember the ones with asterisks are the prototypes that you have to remember for this class.